about it in a minute, but the medical delegation was not head by myself. I was responsible for the surgical wing. So this is including the operating room, the intensive care unit, the orthopedic, the surgery, and the triage as well. I'll speak a little bit later about the triage. And we had an internal wing headed by one of the emergency room chiefs in Israel, in Beersheba, which had the internal and pediatric department. So look at our facility. This was taken by a chopper 2 days after we arrived, this photo. So the blue tents are the one that we were sleeping, the ones in the middle. You can see this is the facility where we are working inside. So look at the different disciplines, the different wards that we were bringing, the OBGYN in the first part, the pediatric area, the operating room, the intensive care area, the imaging, and so on. So we had all the different facilities from the beginning. So we had the imaging department. At least the first week, we were the only one that were able to do X-rays. So with one imaging machine, we were able to do over 100 X-rays per day. We didn't only bring this, we brought, this for the physician, I would say, we brought what is called a PACS system. It's a system where you can see the photos, the X-rays that you are doing, not only on site in the exact tent that we did it, but you can see it in other facilities as well. So an orthopedic surgeon, if he's operating in person, he can see on his screen, he can see the X-rays of this patient. We bought a small lab that could do the basic lab tests with a very small blood bank as well. We bought a monitor for women, and we bought an ultrasound. The woman over there many of the women that came to give birth didn't do an ultrasound. We had a lady who came to us in labor. When we put the ultrasound probe on her, we found out she had twins. She had no idea that she has twins. So this is the level, a little bit different, I would guess, than in Toronto, what you will find. So we could see blood smears. And we bought incubators. We had 2 incubators. These were donated by the JDC on the day that we left with connections of Aura. So 2 incubators was brought with us, with our group. We were the only one with incubators. All the medical equipment that I'm showing here, everything was donated at the end to the people of Haiti. So Israel, we left with 2 planes, the passenger plane and the cargo plane. We didn't need the cargo plane back. 30 tons of medical equipment, these incubators, the tents, everything that you're going to see was left inside for the people of Haiti. Another nice photo of the incubators. And we bought a shul. We were the only one smart enough to bring the shul with us. The third thing, which I think is utmost important, is to be flexible. We started to assemble our hospital at 4 o'clock in the morning. By 10 o'clock, the first patients are arriving. Now, it takes more than 6 hours to assemble the hospital, but you have to think in a flexible way. The patients are there, the patients are dying, you have to start treat. We were doing morning and evening rounds in order to change our policies. This is a situation in which you cannot take anything what you know from your daily work and put it exactly to work the same way there. We had to change staff positions a few times, sometimes every day, because we realized as we were working what are the bottlenecks. So you have to think, you have to operate in a very flexible way to be very different than the way we are now. I thought we were doing this quite well. The fourth thing is training. As was mentioned, I was here in a fellowship till 2003 doing cardiac surgery. When I came back at the beginning of 2004, the IDF decided to change a little bit the shape of this field hospital that is going on for many years. And then I was put in the position of the chief of this hospital. And we're putting a lot of our personal time into reorganizing this unit. So it has a few hundreds of soldiers. We have air and ground units. We have units that can go by choppers, by planes, by ground. And I think of most importance is that we drill every year. I'm leaving my hospital, I'm leaving my house at least twice a year, each time for 1 or 2 weeks. This is a drill, a photo that we did about a month before we left to Haiti. So we are drilling this hospital year after year. So this is a reserve force hospital. All the people in this unit are from the reserve forces. But people in this unit have the mentality to be alert all the time. They know they can be called any minute. So the fifth thing is the nerves, the chutzpah of the Jewish, of the Israelis. So I'll share with you a few short stories. So most of the patients that we were treating in Haiti were patients with limb fractures, open limb fractures. We realized that already when we were in Israel. Now in such a poor country, what you have to try to do the best is to try to salvage as much as you can limbs, because the chance for a patient, if you have to amputate his leg to get rehab or to get a prosthesis, is zero. People don't have money to buy food. They'll never have $10,000 to buy a prosthesis. So we figured out that we have to try as much as we can to salvage and to save limbs. So we brought with us nails in order to put what is called in the medical orthopedic world external fixator. These are nails that you put on the bone. You can clean the wound, you put these fixators, and you can send the patient with them. You cannot put a nail, of course, in the bone because everything is infected at this point. So we brought from Israel about 70 of these nails. We figure out that's a big number. Just to know, these kits cost about $8,000 a kit. The kit is good for 6 or 7 patients. So we brought for about 60 or 70 patients these kits. But with the amount of patients that we were treating over there, after 4 or 5 days, we were out of these nails. So you can see here, Ruben Gelfand, he's our operating room nurse. So when he saw that we were almost running out of these nails, he took pins that we didn't use for any other thing over there. He took a car and he went in Port-au-Prince in town with these pins, and he found a blacksmith over there. And he told him, "You see this? This is what we're going to make." And a day later, we had 200 of these nails. So we would put these nails, we put over 100 of these nails into patients. They were just the same as the original nails. We gave these same nails to other groups who were coming, the Italians, the Americans, who were using these nails. I just want you to have a look on the picture on your right side and just try to figure out which one cost $1 and which one cost $8,000. So casts, we brought with us from Israel, about 1,000 casts. Again, we figure out 1,000, that's a big number. For sure it's going to be big enough. It's going to be enough. But after less than a week, we were out of casts. So one of our physicians took a car, went around town looking for casts. But unfortunately, none of the hospital at that point has casts. And then someone told him that the Moroccan embassy has casts. He thought they were kidding him, because why should the Moroccan embassy have casts? But this physician, just by chance, is from Moroccan origin. So he took a car and he started to drive around town through the alleys, and eventually he encountered the Moroccan embassy. He's knocking on the door and he's asking for casts. They say, "Yes, we have." They opened the basement, they had 3,000 casts. I had no idea why. So as Israelis, we're starting to put Moroccan casts with the Moroccan flag, with the Arabic letters to the patients, and we are starting to distribute these casts to all the other medical facilities that were around. This is a 3-day-old baby. He came with us with a distended abdomen and a severe gastric bleeding, and he was really almost dying. So our physicians were trying to figure out what's wrong with him, and they came up with a diagnosis that probably has a congenital lack of vitamin K. And because of that, he's bleeding. Now, this is something you'll never see in Canada, you'll never see in Israel, not in any one of the Western worlds, because when every baby is born, he's getting an immediate shot of vitamin K for the chance that he has this lack of this vitamin. But of course, in Haiti, no one gives it. So what can you do? It's an easy thing. If you're in Toronto, you're getting a shot of vitamin K. But in Port-au-Prince, no one carries vitamin K.